So looking forward, I will start the webinar in 5 seconds.
PHP.
Hello, welcome everyone. My name is Theo Richardson-Gall. I am the CEO of Public Health Pathways and your host for this live launch event. Today we are joined by an exceptional panel for our discussion where we'd explore shared concerns and new horizons for hope, for cooperation, partnerships, and co-creating a healthier future. For the launch, we are joined by 3 distinguished guests for whom I shall introduce shortly. Welcome Lakshmi, welcome Samira, welcome Alan. First, if I may, an introduction to Public Health Pathways. In May 2020, with rising concerns of the spread of COVID-19, and upon reading the book, Paideia, The Ideals of Greek Culture, the idea was formed and inspired. The idea of a more comprehensive education drive to cultivate excellence in public health. We launched as COV 360 on April 9th, 2020, 13 months ago. So our charity evolved out of a crisis, yet, as the year closed, after we had obtained charitable status, built a marvelously proactive global community, we felt there was still a sense of bewilderment about the situation, about the future. A feeling of fatigue was widespread, the need to understand the impact of the virus across society was starting to show, and a fear of the return of trauma and empathy towards our shared vulnerability. The pandemic has shone a light on our interconnectedness and interdependence. Though there are many public health challenges and questions, will there be another pandemic? Is it a disaster by choice? How do we reduce the possibilities and manage the current crisis? Young people were particularly severely impacted, and there was rising concerns across the world: poverty, isolation, mental illness, physical vulnerability, national instability. These challenges have been at the forefront of our mind as we look ahead. We ask questions about our future. How do we build vehicles to allow us to build a sustainable, healthier outlook for all of society? We were told, find a focus. We didn't. We found 3. Planning the future, securing health innovation, and accuracy, tackling misinformation. Planning the future alongside Gen Z, from our work with bright members of Gen Z in the UK, was developed a public health pathfinder community using a human-centered approach to public health and combining applied psychology and design and systems thinking. They discovered well-being challenges and worked peer-to-peer to co-create solutions. We believe Gen Z pathfinders should be involved in shaping futures. Securing health innovation. We work with local partners in low to medium income countries to provide strategic and administrative support to build sustainable health security alongside an exceptional global team from leading public health universities. We partnered with the Willy Sané Foundation and work under the guidance of the Ministry of Health in Cameroon to reduce maternal mortality. We believe in bidirectional innovation, where together we unlock community-led solutions. Accuracy, tackling misinformation. Through events and trend reports, building on the remarkable success of 2020, our talented trend report writers have delivered insights to help you combat misinformation and access expertise to promote informed knowledge sharing, using peer-reviewed and verified sources to create informative content. Moreover, we work with specialists to bridge knowledge to a broader public through our event. We believe in breaking from old legacy systems to invest in the hopes of younger generations to promote a culture of discernment. Last, alongside our new branding, plans to co-create an organizational ecosystem to promote public health, we have another innovation. If you haven't noticed yet, we have a button on the website. It is a button that can transform our future. It is a button so far unexplored. It is a donate button. With your generosity, whatever large or small, your support for our charitable program will be transformative and can help us from today to build forward as we lay the foundations to build a healthier future. It's been an extraordinarily and exciting journey building this charity from nothing. We together have learned and demonstrated ingenuity and perseverance to develop our Public Health Pathways charity. We are grassroots, local and global, and it's exciting to join us at this time, to support us and to partner with us. Now, with that out of the way, we have an event to focus on. I shall introduce our distinguished panel and hold a short conversation with them about how we measure progress, innovation through cross-sector partnerships, and the role of not-for-profit organizations in building healthier futures. Then invite you in the audience to ask your questions before closing with some final remarks from our guests. I'm delighted to introduce a cross-discipline and cross-sector event. If I may add, each of our guests for this launch event has supported our charity from the summer of 2020 and offered us inspiration and expertise on our journey. First, if I could introduce Alan Court, a senior advisor at the Office of the WHO Ambassador for Global Strategy, has been a director at UNICEF and a senior advisor at the Office of the UN Secretary General, also a trustee of Medicines for Malaria Venture, Innovative Vector Control, and United for Global Mental Health. Samira Khan, a social impact expert, has a fascinating CV from working with Acid Survivors Foundation in Bangladesh, then worked in the private sector as a strategy consultant with Accenture, before supporting global social impact with Kearney, Dalberg, and more recently, Salesforce.org. Lakshmi Sundaram, currently the Interim Executive Director of Open Democracy and Public Health Pathways Trustee. In public health, she has worked as an Associate Director of the Global Health Initiative at the World Economic Forum and was the first Executive Director of Girls Not Brides. Now I'm going to turn to the questions which we've set up. So thank you all for bearing with us on that introduction, and it's wonderful to have the three of you here to join us for this launch event. Lakshmi, I want to start with a question for you. You've influenced global health strategy at the World Economic Forum. My question is about planning, education, and public health. Reflecting on your expertise with Girls Not Brides, you worked with global and grassroots, local and grassroots organizations to impact social change. Considering measurable impacts and those less visible, how do you gauge progress when it's not easily reflected in data?
Thank you so much. And first of all, Theo, a huge congratulations for bringing the organization to this stage. I'm incredibly excited to be a trustee and to be a part of this journey, and really excited to see where you take this organization next. But now on to your question. I think the most important thing is when you work with a wide range of partners, is to work together to really understand the change that you want to see in the world, is to co-create that vision together, especially keeping the people who are going to be most impacted at the center of that co-creation project. You know, people talk about, people get caught up in the technicalities of, you know, what is a theory of change when we're trying to look at especially big projects. At its basic, it is a map of how we are going to get from the state that we are in to the state that we want to see, from where we are today to the future that we want to create together. And once you have a sense of what all those steps could be, then you have a roadmap that helps bring together partners where each person can see the role that they play in creating change. And this is particularly important when you're working on an issue like, like I was working on ending child marriage, where there's so many different pieces, everything from changing the social norms around the value of girls to land rights that mean that men and women have equal access to property, to sexual reproductive health and rights, and changing laws, and being able to present a vision that has been co-created, that has a place for each organization that's working on these different facets, is something that's critical. Now, Theo, you also asked about measuring progress. And one thing that has happened across development over, that's been accelerated over the past 15 years or so, has been an incredible focus on data. And lots of people have talked about how what gets measured is what gets done. But I think what often gets lost in that is that the things that are hard to measure, it doesn't mean that they're not important. It just means that they're hard to measure with the tools that we have today. So what that means is that we have to redouble our efforts and our creativity to find ways to demonstrate that impact, to show those stories of change, and to really be able to gauge that we are making progress on some of the most complex issues that the world is facing, which is what you're also trying to do through public health pathways.
Thank you so much, Lakshmi, for a thorough answer. I think it's really interesting to hear that last point and picking up on it. Do you have thoughts on those innovative and creative ways that we can learn to measure impact?
Well, I think, again, if we have a good, solid understanding of what are the steps that are going to lead to change, then we can start thinking about how to measure progress against each of those steps. So again, if I go back to the issue of child marriage, the most standardized measure of progress on child marriage is something that's measured by UN agencies across the world, and it's the proportion of women age 18 to 24 who were married before the age of 18. That's very helpful. It doesn't help us today to know whether our programs are having an impact. It doesn't even help us to know if programs that we started 3 years ago are having an impact. So we have to break it down and think about what are the pieces that we're trying to change. Is our theory of change solid? Can we kick the tires of it and push our, really challenge our assumptions and think about, okay, is it about changing social norms? Right, let's dig into how can we measure changing social norms. Is it about girls' access to schooling? Right, let's try and figure out ways to see not just are girls on the rosters of schools, but are they actually turning up at school? And are they learning things that are useful for them? It's going under that top level of data and really trying to understand what is it that we're trying to change and what are the pieces of information that will help us tell that, gauge whether that change is happening. And usually those pieces of data are not the most easily collectible. They're not the most easily comparable, but that doesn't mean we shouldn't be using them. It means that we have to pull together a constellation of sources of information to create a full picture of the change that is happening and to identify where we need to put more effort.
Thank you so much for elaborating there. I really like the point that you make with a constellation of ideas in terms of measurements and how we look at those from looking at the personal testimony to looking beyond in terms of what the data is indicating and other aspects which really need to be looked at. And I think that was wonderfully demonstrated by you from your work with Girls Not Brides and those experiences that you mentioned. So thank you very much, Lakshmi. Samira, I'd like to turn to you if it's okay. And I think it's a related question because in a sense, we look at impact in very different ways from the private and non-profit sector. The question that I have is based on your experience in working with not-for-profits and with the private sector, both directly, With the increasing consumer and customer interest in the social role companies perform, creating shared value in health and well-being, how do you envisage private and non-for-profit partnerships in the future? And also, if I may ask, how do you believe these collaborations can help us build sustainable environments to address local and global challenges that inspire actions?
And thank you so much for that question, Theo. It's a very timely and important question. And I think part of the sort of vision of cross-sector partnerships is being influenced by how each sector in and of itself is changing. And then the other aspect of it is how these sectors are recognizing that they can't solve these large global challenges, these sustainable development goals, and these far off challenges that are affecting some of the most vulnerable communities across the world. They can't do it alone. It has to be a cross-sector approach. And I think both of those things are really underpinned by this recognition that we need a different model of operating to achieve a shared future that is more equitable, that is more sustainable. So if you look at the sort of private sector or the corporate sector, there's an increasing trend or push towards defining corporate purpose as more than just profitability, but something beyond that, something rooted in value creation, something rooted not just in mitigating negative environmental impacts or mitigating negative harms or trying to avoid, say, risk and blame with regards to workers' rights. It's about how do you actually use the full power of a corporation and all of its different assets and types of assets to create value for society. And what I mean by that is, in the case of Salesforce, where I most recently worked, it was really about, A, how do we use our technology, our intellectual property, our products for social good? How do we take the underlying customer/constituent relationship management platform and apply it to solve some very critical challenges, such as around vaccine distribution, such as around going back to work after COVID, such as those faced by nonprofits. It's also about how do we use our people or our talent, which is another, say, resource or pool of assets for social good through pro bono work, through, volunteerism, through the unique skills we're bringing to the table, through actually being able to create different opportunities and new jobs by tapping into previously untapped resources, by the way in which we recruit differently. So it's not just about, markets. It's also about how we create broader value in society. I mentioned the product side, I mentioned the people side. There's also a huge component of networks. Salesforce, through its customers, through its partners, has huge and large networks that help us scale our own social good programs. So how do we expand access to those? So there's different sort of angles that we're targeting to paint a picture of value creation. Now, in terms of priorities, many of them are set by executives at companies. C-level people, board level discussions saying, I really care about climate change, or, this issue is happening in my backyard and I want to address, let's say, homelessness, etc. However, I'm seeing more of a bottoms up approach as well, where employees are taking, for lack of better words, an activist stance and saying, I want the place I work to represent and mean something different in society and to create value differently. So there's that bottoms up movement, grassroots movement within for-profit companies that is taking place as well. I'm so keen to watch that sort of purpose movement and that purpose journey. And the third aspect that I'm noticing is this concept of stakeholder capitalism. I think there's a long way to go before it fully comes to life, but at least the discussion is on the table. So how do we go beyond thinking about just our shareholders to thinking about those we impact through our supply chain, to thinking about our employees? And in the pandemic in particular, when employees were struggling with family issues due to economic constraints, when mental health was top of mind, when remote working was very difficult due to familial obligations, this became ever important. I think corporations recognize that in order to be profitable, to be sort of, valid in the marketplace and to continue to grow, they absolutely must prioritize employee health and well-being, and health and well-being at large has sort of emerged to the top. So that's with the corporate sector. And I think that corporations realize that in order to actually serve these other stakeholders, they can't do it alone, because nonprofits, with their sort of growing proliferation across the globe, bring very unique solutions that are community specific, that really are based on understanding community needs. These nonprofits have the relationships with the community to offer holistic solutions. They understand some of the supply chain issues better. They understand some of the power dynamics better. Where they struggle is often fundraising, access to capital, and scale. And that's where corporations can come in and open up their networks and open up their IP, and also use the range of capital and resources they want to deploy to help serve shared agendas, impact agendas around climate change, around education, around workforce development. So I really see there being a growing space opening up between nonprofits and corporations. Part of it's rooted in how we can think about the entire capital continuum and deploy capital differently. Corporations are increasingly doing grant making. There's an increasing push toward sustainable investing, but also impact investing. And then there's obviously the product side as well. How can nonprofits and corporations co-create or co-innovate very relevant products for hard to reach markets is another aspect of it. The final piece I'll kind of conclude on is that I think technology has a unique role to play as we think about access to these markets and understanding them, and access to information and transparency and accountability in such a way that corporations will be pushed even harder if technology is used for good and there are some boundaries around it. So I think there's a lot of work to be done, but I do see potential in sort of leapfrogging some of the challenges that have existed in history in nonprofits and corporations working together. So I do think it's a unique time that way. And I will say that there's a third stakeholder, which is the public sector in terms of governments and social service providers and et cetera. So to really be able to offer a holistic solution to a systems-wide problem, I think it's important to also bring the government to the table. And I think there's a lot more work to be done there, but I see that as being a promising area as well, as we create a sort of shared future that is sustainable and more equitable.
Thank you so much, Samira. That's really interesting to hear and reflect on how there is almost a shift in consciousness occurring right now, presently, and that has itself kind of led to more investment in terms of time. And I guess speaking to the event itself, and health being the new definition of wealth, what do you feel about the consciousness within the private sector in terms of shifting toward more health-based policies, as well as internally and looking into the communities more widely, in addition to those partnerships? Do you feel that that's a growing space? And I'm thinking here in particular for our charity organization, where we look at community innovation and look for partners and support through that. And what comments do you have in those concerns in terms of how the private sector is working with health agendas and supporting the sustainable development goals as well?
So as I think about tech in particular in the private sector, I think we've done a relatively good job of trying to create products or solutions for different markets with respect to health issues and health challenges, working in partnership with startups, working in partnership with community organizations such as academia, where they really have the knowledge. So I think that aspect, I see movement in a positive direction. I think as far as employee health is concerned, and really addressing health issues from a philanthropy perspective, stakeholder feedback, engagement, knowledge of communities, I do feel that there are huge gaps. I think we don't currently have the infrastructure to get the right type of information to take an outcomes-driven approach to deploying, let's say, our capital and assets to solving some of these health issues. I do think that we need more channels for stakeholder feedback, whether that's our employees or some of the markets we operate in. We need more cross-sector partnerships, more strategic partnerships. I think the product side and the, building usable products and services for markets, that's a little bit more robust. Everything else there's just a long way to go, where we may not be asking the right questions, may not have an outcomes framework in some cases, or may not have access to the type of information to really get to the core and heart of the issue.
Thank you very much. I think it's really interesting to hear that the project's unfinished. It started, and that there is things to be done, and there's people to be listened to in terms of collaborating and filling those spaces where I believe there's great potential from a cross-sectoral point. Thank you so much, Samira. And Alan, I want to bring it to you and a question which is really reflective of the fact that you have advised at the highest levels of global health and directed UNICEF on the SDGs to managing malaria responses across continents. And the question which I've got in terms of how we think forward is, in your view, what should non-for-profit organizations and charities focus on to improve public health at this time?
Thank you, Theo. And I think you've just described why I've got grey hair. So, first of all, I, as a response, I want to start with something that over the past year, you've personally shown, and that's the word resilience. And one of the things we've all seen and we've heard that is needed in this COVID or post-COVID world, not that COVID will go away, it's likely to be with us in some form or other. It's the word resilience. But what does that mean? We hear it in terms of health systems. We have to build resilient health systems. So what does that mean? It means we invest in health ministries, health departments, hospitals, health centers, workforce, health workforce. What it misses in all of that is the last mile, to actually get some impact at the end of that chain, and something that links communities with wherever that chain's final point is. Same with private health distribution, whether it's the shop at the corner selling medicines over the counter or whatever it is. There's something there, and the role of non-government organizations has been traditionally to innovate and to bring these local innovations to the fore in terms of those who might be funding them or expand them. So whether it's to the regional government or country government in a particular country, or to a potential donor, if we're talking about aid and aid transfers, whatever the NGOs have done locally to bring good systems to bear with communities. And this, I think, helps to explain something that Lakshmi was actually talking to, and bring that back as part of the whole chain. It's not everything, because it still needs to link with supplies, link with training, link with all sorts of expertise on the way, and link with funding. But still, that is perhaps, if we turn it around, that last mile becomes the first mile of where an NGO that's operating in different geographies can work. Now, these can be local NGOs too. I'm thinking of one in Bihar, in northeastern India, a local NGO that had this problem of malnutrition in newborns, or the first year of life of newborns. What they did is they brought together all the mothers who had given birth in a certain period of time over the previous year together, and organized communal feeding together to discuss what are the issues, how are we going to change this around. To Lakshmi's point earlier, it did generate data, but it wasn't the data that had impact. It was these women talking amongst themselves and then learning maybe different practices from each other that actually solved the problem. So within 3 years, that malnutrition had virtually disappeared in that age group. And that's something, you know, in terms of, I think it's something politicians in the North, the global North, have known for a long time, the role of focus groups and how we sort of go beyond data and statistics. Just sit down with people. Sometimes focus groups are done to get feedback on what you want to hear, but if it's done in the way that I sort of laid out, where people are actually talking to each other and not talking to you or to a charity or an NGO, but actually talking to each other, that's where solutions come out. And that's something I think NGOs have a particular role to play, because then that feeds back up the chain. And that's very important. And this is for both national and international NGOs. At the other end of the scale, obviously, it's advocacy. Advocacy for whatever is top of mind, and how you get that advocacy to create waves and input. And we've seen it. Those who are supporting the NHS in the UK over the last year, for instance, and you know, the spontaneous Thursday clapping a year ago, or whatever it was, at that point, so important, because that impresses on those who hold the purse strings, hey, this is important, we shouldn't ignore it. And that becomes an issue for those that make decisions then. So advocacy, there are different ways of doing it, doing advocacy locally, regionally, nationally, or internationally. And, you know, certainly the way that feeds into organizations like the World Health Organization is important. Some of the best practices in health have actually come out of grassroots efforts around the world. In Brazil, in Guatemala, in India, in Bangladesh, in China. So some of the best that we've got on record have come out of there. What to do where there is no doctor, for instance. Just one example. So I would say there's a role at both ends of the scale, if you like. And wherever you are as your national organization, and I've seen there's an organization in Egypt on the chat line that's starting up. It's how to position yourself, how to get the best information and bring it to national attention or international attention. And that, to me, is the primary way of leveraging the capacity that you have to do that without having those massive resources that governments have and larger organizations have. It's how to make the best use of the resources you have to leverage the kind of results and the outcome framework that Samira was talking about, which is so important. What does this NGO want to actually achieve in whatever geography at the end of 10 years, 5 years, 3 years, the end of this year? And that's going to be an important pathway to determine how you want to work, whether it's dealing with maternal mortality in Cameroon, as you mentioned, Theo, at the outset, and PHP is focused on. I think that's an excellent example, and where you can show how that can work.
Thank you so much, Alan. I think, thank you personally for that comment in terms of how organizations demonstrated resilience. I think that's a wonderful compliment to have. And working with communities to really listen, to embark on social listening to find their solutions is definitely something which we strive to be able to do. So thank you for alluding to that. And I think it's fascinating to hear those different examples which you've provided in regards to these aspects. And how do you feel about sustaining the current momentum? Because I think there is more interest in terms of public health at present, and that's excellent, and that's where it should be, one could say. How do you feel about us sustaining that? Maybe it's public pressure, maybe it is the coordination amongst governance organizations and non-for-profit organizations to be at the forefront of ensuring that health after COVID for some countries remains high on their agendas, so that we build forward and don't find ourselves where we are currently.
I think Theo, we have to build on what is out there, because the natural thing is we'll forget about it in a year. So how do we avoid that? If you recall, following Ebola, there were a lot of calls for building up resilience in countries and so on, those that had been affected. You know, the earlier COVID one, the earlier Ebola one in West Africa, 2014-15, didn't happen. One country did build up its network, and that was Ghana, where there weren't Ebola cases per se, but that's where a kind of regional headquarters for dealing with the West African Ebola crisis was set. They actually intervened very early. I think they were the first country to introduce airport-based testing and insist on PCR tests prior to getting on a plane to go to Ghana. And that was the 1st of September 2020. Think of how much longer it took the UK to institute that. And then they had testing at airports with a workforce of 250 people working in rotation, sometimes medical students and others that were brought in half-hour rotating shifts, half hour on, half hour off, everything done at the airport with an antigen test, which at that point was difficult. They had to source it in South Korea. There's nowhere else they could source it from then. WHO was still looking at what is good, what isn't. They were still testing them, but it worked. And they managed to, and they were one of the first to isolate people in hotels who tested positive on arrival, either because they had a fake PCR or something like that, whatever it was, or just the PCR hadn't picked it up and somehow it had emerged during the flight, 5-6 hour flight, can do, I guess, it's picked up in the antigen test that happened. So there was a learning there, but Ghana was one of the only countries. Many other countries have learned from Ghana since how to deal with this particular pandemic, including the UK. There was a governmental visit to Ghana in December, I believe it was, to see how they were doing it. So, and this is third world to first world, if you want that terminology, technical transfer. And it's on the operational side that they did it, not the technology side. The technology was available to everybody. But it was on the operational side and the thinking behind it, how to implement. I found that fascinating. So moving forward, how do we learn from this? We've just had, and this week I think it'll be made more public, the report of the independent panel on pandemic preparedness, which will be presented at the World Health Assembly now, this week or next week. And that's going to be important because that calls for a number of things to happen, including the strengthening of institutions and so on, and building up of capacity in countries. So I'm thinking, how do we build on what we've got? How do we build on that report to make sure that doesn't just go on a shelf, which it might well do, to make sure there is action on it? And here's a role to play at the high level advocacy level. And so how do we take that, take the different parts, what does it say, put it into understandable segments, put it out on social media, this is what's being called for, and get people to write to their, whoever their political representative is in Congress or in Parliament or whatever, to make sure that this is followed through in international health bodies and national health bodies. So that's one. Two, in various countries, is how do we use the influx of aid, financial aid up to a point, the new technology that we've got, to not just make sure we build resilience for the next pandemic, and you asked that in your opening statement, Theo. Yes, there will be another pandemic. We don't know what it will be, but there will be one. But we have to build up local capacity to detect and then to quickly assess and deal with it, whether that requires bringing in expertise from outside or not, That's a different question. We just don't know at this point. But at least that initial capacity has to be built up. But in doing so, building up surveillance capacity on health and diseases, we can build up responses to HIV, which our friend from Egypt is talking to on the chat, malaria, tuberculosis, and others, all the diseases, plus we can actually build up capacity to deal with the issues of maternal mortality or improve maternal health. You can just switch it around, just building on the back of what will be possible after this pandemic, focusing on not repeating the mistakes of the past, learning from them, and building up resilience and capacity.
Thank you so much, Alan. And if I could add something which you did, which was also remembering that the innovation is occurring in the Global South, and through that example that you provided in Ghana, it's remembering that that example exists as we go forward and hopefully prepare for the future.
Just to add, one of the early tests to be actually developed was actually at the Institut Pasteur in Dakar, Senegal, and used locally. Very good, very effective. So technology can also emanate out of the Global South.
Thank you very much, and thank you for raising that point. I think it's important. We're all aware of that as we move toward this direction where hopefully there's promise that there'll be more capacity to develop vaccines in the Global South in the future as well. Lakshmi, there's a few questions which have arisen in the chat. If I could turn to you, and I think maybe if I combine them and you can go through them. But the first question was, do you think qualitative means should be given equal importance to evaluating impact? And the other question was, do you think creating agency in vulnerable communities is important? And how much of a part does it have to play in the success of programs? And how do you build programs that enable this?
So the answer to the first question is absolutely yes. And Alan gave a really good practical example of a situation where that was indeed that qualitative data painted a much broader picture and a much more complete picture of what the impact of this this meetup of new mothers was able to achieve. And I think if you hadn't had that story, it would have been very difficult to understand why it was that 20 new mothers meet up. 2 years later, health impacts of the health of their babies is better than it was before, right? Like, what would you be able to do with that information? Not very much. When you have the context that Alan provided, it provides so much more information about what it was, like what were some of the pieces of this program that were critical to success. So I absolutely think that the qualitative data is critical, and particularly when you start thinking more about issues such as social determinants of health and maybe more complicated health situations where it's not just a question of here's a very classically defined disease, we have to provide X number of pills to X number of people and then they'll be fine and then they go on with their lives. So many of the problems that we're dealing with and more that we're going to see coming up are likely to be quite complicated, where you have environmental factors, socioeconomic factors, race and class have had an impact, and we've seen that massively through this COVID pandemic as well, where we've seen people from certain communities, whether that's in the global north or global south, are being disproportionately affected and dying at disproportionate rates compared to others. I think these are all lessons that we have to find ways to keep exploring, to really understand, why is this happening? What can we do to prevent these kinds of impacts in future not only in future pandemics, but also in future like non-pandemic normal normal disease situations, where it's sort of trying to understand the real broad full picture of why we have certain problems and what it will take to fix them. And I think a critical part of that is listening to the people who are most affected and being guided by what they say. I think a lot of, not all, but quite a lot of public health in the past has been quite paternalistic, has been quite sort of, we are the experts, we know what is best for you. If you don't follow the instructions that we give you, it must be because something is wrong with you, rather than trying to really understand what is driving people to behave in certain ways, take certain actions, and working with them to find solutions that work for them. And so I think some of the most long-standing successes come from situations where people who have been most affected by a problem have an important central voice in describing their needs and their situation, and working to make sure and working hand in hand with allies from across the spectrum to find solutions that are actually going to work in real life, not just in a lab context.
Thank you so much, Lakshmi. I think that was a very thorough answer in regards to how we've got to move forward. And I particularly point out that where you say that we've got to move from more prescriptive models or paternalistic models to instead and rather listen to communities in terms of how we find solutions and also understand what the problems are as they're occurring. And possibly, and turning to you, Samira, possibly there's things from your experience working in tech that you have comments on that in terms of how we are developing there. I'm mediating between some questions coming up on YouTube and some questions coming up here. There is a question that's come up, Samira, which I wanted to ask you, which is how do we ensure that our younger colleagues participate creatively and productively in projects, taking into account that they are building their expertise and experience in the field they work?
Yeah, no, that's a really good question. First of all, I'd just like to say that as far as, the younger colleagues or youth are concerned, I think it is a huge resource and an asset. It's an, not untapped, but less tapped resource and asset. They're bringing a different mindset to the table oftentimes just because of the world that they're living in, the challenges they see coming down the pike in terms of having an environmentally sustainable future, et cetera, and this future of the planet. And this mindset shift that they embody is something that I have found lacking in a lot of corporate executives, and something that needs to be actively worked on with them. So I would say we leverage, some of the more forward-leaning youth who are leaning into health equity issues, who are leaning into health quality, health access, who are leaning into whatever the topic may be. And we try to give them the tools, the information, the educational skills necessary to affect change. We identify what are those pathways that they can potentially affect change in, whether it's through a project, as you mentioned, through the projects that you're developing or co-developing, or it's through career pathing. So really make the right skills and educational tools and information available to them and tap into their current mindset. For those amongst them who are not yet there in terms of mindset, just because our educational, I feel, system still hasn't caught up. Social issues are not highlighted in a particular way. Entrepreneurialism isn't built into the curriculum in a way that I think it should be. There's obviously progress. How can we create more innovative coursework? How can we create you know, things that push them toward a more entrepreneurial mindset, especially vis-a-vis social impact challenges. So I think there's a mindset element to it, tapping into those who are forward-looking. There's also an educational curriculum component to it, and how we can sort of change the education system and how the projects can work in partnership with educational institutions. And then there's this notion of voice. I think we have seen some brilliant, you know, youth change makers from across the globe who are emerging, but there are probably so many more who don't have the platform, the voice. They don't have the same assets available to them to be heard. So what kinds of platforms, and how can we use tech to enable that? The last thing I'll say is I've been involved in a number of youth sort of competitions over time and pitches, very impressed by how when people from different parts of the world come together and try to solve the same challenge, what sort of emerges and comes out of that. And I know a lot of corporations are behind supporting that, but the challenge is what next? So once these sort of pitches take place and somebody gets some prize money, they're kind of left to the wild west of VC or, you know, philanthropic dollars. There aren't often these pathways to help these youth with great ideas scale their innovation. So I think there's more to be done there as well.
Thank you so much. I really like what you said about innovative mindsets amongst young people. It's certainly something that we've experienced in Public Health Pathways, working with Gen Z and seeing how they can collaborate and bring ideas together. And as you mentioned as well, when you raise that to a more international opportunity where you can collaborate, it's that much more interesting to see what ideas arise. We've got 9 minutes left. There's a question I wanted to ask you, Alan, that's come through on Facebook, in fact, which is on misinformation. And how do we drift away from social media attention when it comes to information digesting and push it towards more verified and reliable information channels? It might be a question that you've come across in terms of how the WHO are trying to manage this drift into misinformation on social media.
Yes, it's a tricky one, and partly because if you think maybe 50 years ago, 75 years ago, or less, we relied on just a few sources of media, whether it's radio or television. And then radio took off exponentially with very individualized broadcasting and decentralized broadcasting. So around the polio, huge polio epidemics of the late 1940s and the early 1950s, radio and to some extent TV played a huge role in having people understand what's going on and what they needed to do about it. And that fortunately coincided with the innovation of two vaccines really at the time, the Salk vaccine and the Sabin vaccine, which, I mean, they're still around. It's just amazing, and they're very effective. Now we've got multiple sources of information, and it's segmented to what we want. Thanks probably to advertisers who are trying to sell products for whoever's producing the products. They segment their audiences to those likely to, who's watching what's their interest, etc., etc. So we're all segmented out, all of us, and all four of us on this panel are part of those being segmented out. We're also targeted, in a sense, by what we receive on social media. So how do you deal with that? Actually, the BBC had a very good long article on how to deal with misinformation, I think this week, online, which is very interesting. And you know, for instance, it says, instead of just passing anything on that seems to be of interest or unusual or shocking or whatever it might be, check its source. Is the source of that information verifiable or not? If it's not, don't pass it on. So there's a lot put on the individual there to actually check what's the information that's coming in, and should I be passing that on, yes or no? And that's going to be important. Then there is, of course, the regulatory side of what has to be banned or not. And then you go into, you know, the whole issue of freedom of speech and and privacy issues on the other side, and so on. But I think the main onus has to be on the individual to begin to discern and begin to weed out things that are verifiable and those that aren't, and narrow down the trusted sources to those that you really trust. I'd say on something like an outbreak of a disease, first place I turn to is the World Health Organization. The second place I turn to is probably the UK, Public Health England, for instance, or the US CDC, Centers for Disease Control. And that's just me, and that's my background and where I look to first for the information. But I find that the information they put out is usually, up to the point they put it out, the best information available. Some of it is overturned later, a month later, 2 months later, a year later, you know, with new information as it becomes available. And we have to understand that science isn't necessarily a precise science at the beginning. It's based on the available evidence to date. And so, as the available evidence increases, the scientific solutions may shift. And we need to understand that too. So there's no absolutism in that either. I think what it refers to right now in particular is this vaccine hesitancy. I mean, if we think the issue of 6 people having a problem with the AstraZeneca vaccine out of how many millions that were vaccinated, 6 out of 6 million, I think it was, creating a problem throughout the world, including in parts of the world where it wasn't an issue. And that's bothersome to me. And here, going back to the earlier question on NGOs, what's the role of NGOs with media? How do we go hand in hand with media to find the truth and to analyze, what does this mean? And I find, for instance, some outlets do it, but you have to look for it. So the Economist podcasts, for instance, do that. They do analyze what's happening around. The BBC does analyze, and there are others that do analyze, but my goodness, you have to look for them and find them. And so how can NGOs help bring that more out into the general arena in the countries in which they operate? And that might be very helpful, because they do give different sides of the story. There can be really good reasons for hesitating to have a vaccination, but there also, much of the reasoning is just it's not available. So, I'm not going to get it, and it's not here anyway, as somebody who's been vaccinated, and twice. And so that is something that to me is very important. The other thing is what's important, and you said it early on, Theo, building up vaccine manufacturing capacity around the world, especially with the new RNA science that's there. Not so easy to build up. It's very complicated. Material sourced from around, I think, 80 different countries, if I read right, for one of the vaccines. And so, if there's a supply chain breakdown, there's a problem, but that needs to be built up. It's part of the building resilience around the world. So, for the bulk of the vaccines that COVAX, which Gavi and the World Health Organization are leading, do not come from a single supplier. In India, which has now its own problems, and they've had to stop exports. So that kind of almost monopolistic approach to buying has to change, and look at potentially, when there's something like this, with a risk of stockouts or problems of this kind, multiple sourcing, if possible. That takes a lot of negotiation. Yeah. But how do you deal with the misinformation in that? Look for the truth. How do we assess the truth? As I've said before, it's on every one of us to look at the sources of information before we pass on what comes across our mobile cell phones or screens at any given moment. That's the main thing. And then repeating information from trusted sources.
Thank you so much. That's very, very helpful, Alan. And we're running low on time. It's very helpful, I think, one, because it kind of draws on this area which we all find ourselves in, where we're more exposed and maybe more vulnerable to picking up on misinformation, but also have this greater influence, particularly because of the ease and access to distributing and influencing those around us. Could I very quickly, before we go, just ask you for any concluding thoughts and advice that you've got for our charity? And if I could start with you, Lakshmi.
I think just very quickly, what's been clear throughout this conversation is the importance of people feeling empowered, especially young people feeling empowered, and being able to know where to access information. And I think that the work that you're doing, particularly with younger people, in helping them to start thinking about public health, not just as this like esoteric thing that's often in the corner, but something that impacts them in a day-to-day way, and starting to gain fluency in different aspects of public health is something critical. It's critical to the comments that Samira made about becoming more involved on the tech side and bringing some of their brilliant ideas to tackle problems, but also on the issues that Alan just talked about, in terms of really being able to sense check things that they see and they read, and then being also able to share messages with their families, their communities, and feeling empowered to do so, because they know that they're relying on a basis that is made of evidence-based information, like some of the reports that Public Health Pathways has been producing. So I think just really, again, identifying some of these challenges and finding real practical ways to tackle them is the way to go. And I'm, as I said at the beginning, I'm really excited to see where you go next.
Thank you so much, Lakshmi. Very kind words, and thank you for mentioning the trend reports and the successes which they've offered. Samira, if I could ask you whether you've got any guidance for our charity Public Health Pathways.
Yeah, building off of what Lakshmi brought up very early, this question around data and making sure you sort of get the right data. Keen to see how you tap into stakeholder feedback and sort of track feedback and ideas from different communities and mine that data to cross-check some of our sources, as well as to enhance the qualitative and quantitative pool of data available, especially with regards to some of the hardest to reach populations.
Thank you very much. And yes, I think something to strive for is to really integrate that feedback as much and as best as possible, as you allude to. Alan, if I could bring it to you for a final word of advice for us.
Well, thank you. And I'm just referring back to something Samira mentioned earlier in terms of employer-employee relationships and what's interesting employees, for instance, climate change, especially younger employees, and how the senior executives often don't get it. Maybe something to focus on could be this whole nexus between climate and health. It's going to come up. That's the big thing over the next 10 years. And so you can look at that maybe on the back of this pandemic, as it's brought under control somehow. We could actually build up on that. And the most visible aspect of that, perhaps for many people living in cities, is air pollution. And then how do we bring that to bear and that information to bear? So it's just a suggestion here on something to look at that's going to have increasing importance in the world. And then just finally, congratulations again to you and the team and everybody. It's just fantastic progress in a year. And all I can say is, you said it's taken time. I can say just in a year, it's amazing. And this last year as well. Congratulations.
Thank you so much, Alan. Much appreciated. And thank you all for joining today. I think we've covered so many interesting topics and alluded to the projects which Public Health Pathways are working on, from bringing young people together and internationally together to collaborate and to create designs and listening to communities. And also, as I think all three of you alluded to toward the end, in terms of discernment, and how do you cultivate that in communities and ensure that that goes forward. So I would like to close off, because we are on the past 5 minutes past where we were supposed to end, but a huge thank you to the community, the incredible community who built this charity and made it all possible to bring us here. Also, thank you so much to the audience for joining us today for this event. And thank you, Alan, thank you, Lakshmi, thank you, Samira, for joining us for this Public Health Pathways launch. I do like to finish on a quote, so I'm going to overlap that into what Public Health Pathways do. And if you want to find our donate button, I will share that also in case it's of interest to explore. So the Scottish microbiologist Alexander Fleming said, "The more complex the world becomes, the more difficult it is to complete something without the cooperation of others." At Public Health Pathways, we believe that innovation to make society healthier comes from within communities. Our mission is to inspire innovation, co-create sustainable solutions, and strengthen communities to reduce health inequities. And if I may borrow an African proverb to finish, if you have health, you have hope, and you have everything. So I'm wishing you all a pleasant day. Thank you so much for your time today.
Thank you, Theo.